to look at the physiology behind cystic fibrosis. So we began this web series kind of on a cellular level, talking about the cellular physiology and then, kind of a brief overview of all the different systems affected. Then in the last episode, we went specifically into the central nervous system and the muscular system and how CF affects those two systems. Well, today we're going to talk about the respiratory system and the pancreas. Now, for today, regarding the pancreas, I'm only going to focus on one specific complication from the disease. However, in the next episode, I'm going to go much further into how CF affects the pancreas, ultimately affecting the digestive system, causing a whole host of issues. But for today, what I want to talk about is cystic fibrosis related diabetes. So in normal or non-CF patients who have diabetes, there are two different types, right? We have type 1 and type 2. I'll give you a brief overview of what they are. So type 1, it's an autoimmune disease, basically means the patient's own body's immune system is attacking and or destroying the cells in the pancreas that produce insulin, the beta cells. Then we have type 2, which is mainly found in, not always, but most often found in adults who are obese or overweight. And what this is there's a lack of a normal response to the insulin, in addition to, the pancreas possibly not producing enough insulin. So you have type 1 and type 2. Basically, B cells being destroyed or beta cells being destroyed, and then kind of beta cell dysfunction, if you will. So the reason I wanted to quickly talk about those two different types of diabetes is that cystic fibrosis related diabetes shares some of the features of both type 1 and type 2 diabetes. So, we've talked about in all the episodes that the main characteristic of cystic fibrosis is this overly thick secretions and mucus, right? Sticky, thick secretions. So in the pancreas, what happens is that thick mucus actually causes scarring. And this scarring prevents the pancreas from actually producing the normal amounts of insulin. So like people with type 1 diabetes, they become insulin deficient. The pancreas still, maybe still making insulin, but not nearly enough to stay healthy and, maintain good nutrition. So in addition to that, people who have cystic fibrosis related diabetes may not respond in the right way to the actual insulin. So this kind of mimics people with type 2 diabetes. This can, occur more frequently, or especially occur in CF patients who are sick or taking steroid medications, women with CF who may be pregnant. So this is referred to as insulin resistant. So as you can see by the slide I have up here on the screen, it's pretty complex cystic fibrosis related diabetes, but it all begins with that defective CFTR protein that we talked about, and then can lead to all sorts of problems. But ultimately, if you look down, it drills down to two things, B cell loss or B cell dysfunction, which then leads to decreased insulin production and then ultimately diabetes. Okay, so that's, cystic fibrosis related diabetes. And like I said, the next episode, we're really going to drill down even further into, problems with the pancreas, which lead to ongoing and severe issues with digestion. But now let's dive into the respiratory aspect of cystic fibrosis. All right, so respiratory. Now, as we know, the CFTR protein is an ion channel, right? We talked about that in the previous episodes. And this helps move negatively charged chloride ions in and out of the cells that produce mucus and sweat, saliva, tears, digestive enzymes. But this protein also helps to regulate the movement of sodium in and out of the cell. Now, I want you to remember throughout this respiratory lecture, one important thing that this amazing physiology teacher taught me once, that water follows salt. So knowing that this CFTR protein is responsible for, not only chloride ions in and out, but the flow of sodium and ultimately getting water into our tissues, which is how in a normal patient without cystic fibrosis, our mucus is nice and thin and slippery the way it should be. So we talk about the lungs and the respiratory tract, or the lower respiratory tract to be exact. Now, in a normal patient, no cystic fibrosis, imagine you've got this tube and you've got this nice thin slippery mucus moving through it. And lining that tube are these hair-like projections called cilia, and they help kind of move the mucus along, all while trapping, anything bad that we might have taken in that we need to get rid of, dirt and bacteria, dust, any kind of particles, or anything along those lines. Well, now take a cystic fibrosis patient. We know that there's a defect in that protein or that ion channel, whether it, never leaves the endoplasmic reticulum, making it up to the cell membrane, or it does actually get up to the cell membrane, but due to a misfold, it's not actually open properly, so you don't have the flow of ions like you should. Ultimately, sodium, and then what follows sodium? Water. So this is what leads to those overly thick mucus. So again, imagine the airway, imagine the lower respiratory tract and the cilia lining that tube, and now you have this thick, heavy mucus that can actually sometimes crush the cilia, leaving them totally inoperable, or it's, they're trying to move it along, but they can't. And then ultimately that's not trapping the bacteria and the dust and all the, bad things that we need to get rid of. So it all just sits in there and it colonizes and it causes repeated infections, and over time can actually lead to respiratory arrest, which is one of the main causes in cystic fibrosis patients. So again, this overly thick mucus can lead to blocked airways. In other words, obstructive pulmonary diseases such as emphysema. Can lead to hyperinflation of the lungs, which can lead to air trapping in the alveoli sacs, which can actually lead to a rupture of them, and that can ultimately cause a pneumothorax, heart failure, pulmonary hypertension, really a whole host of issues. So you're going to find that your cystic fibrosis patients are probably on a ton of antibiotics to combat all of these respiratory infections that they have going on due to this, colonization of bacteria and the mucus not being moved out properly. And then on the upper respiratory tract, you're going to find, especially with children with cystic fibrosis, problems in the upper respiratory tract. They can have these nasal polyps, which are like small growths of tissues that form, the lining of the nose. And what happens is they go into these air-filled spaces behind the nose in the nasal cavity, and they sometimes get so bad that the polyps actually have to be taken out by healthcare providers, because otherwise it leads to repeated sinus infections, snoring at night, problems breathing through the nose. Some of the respiratory issues that you'll see in these kids and even in the adults is chronic cough, coughing up blood. You can see collapsed lungs, as we just talked about, pneumothorax. You can see what they call clubbing, which is kind of like a rounded enlargement of the tips of fingers and toes. Just frequent lung infections, and that can lead to heart enlargement, like I said, and ultimately heart failure, pulmonary hypertension, just a whole host of issues. So that's why you're going to often hear cystic fibrosis referred to as the lung disease, because many of these patients need and will often receive, if they can, double lung transplants because it's just so bad that the infections, that they're becoming resistant to certain antibiotics, and that will just ultimately lead to death. So the respiratory issues caused by cystic fibrosis are no joke. They're one of the main components of the disease. And, if you're treating patients with cystic fibrosis, you really need to be aware of that. So that's basically what we're going to talk about for this episode. So, like I said in the beginning with the pancreas, we touched on just, one aspect of it with the cystic fibrosis related diabetes. But in the next episode, you're going to see us go a little bit deeper and then talk about the digestive system, how that's affected. And we're also going to talk about the reproductive system and how cystic fibrosis affects that. So thanks for joining us, and we'll see you next time.